All right, thank you, Rachel. Thank you, everyone. So I'll start off by saying this is another set of results coming from an observational study within the Recover project. And so like the other projects in that initiative, this is a team effort of many people across many sites and with input from community representatives and important contributions from all of our participants and everything. So I want to start by saying that, and this is a list of just some of the people involved. So unlike other things that you might have heard in the Recover pregnancy cohort, well, I guess I'll start by saying this is also an NIH-funded study, and I don't have any conflicts to disclose. So other viruses that predate SARS-CoV-2 are well known to have potential adverse outcomes associated with exposure in utero on infant neurodevelopment. So things like Zika or cytomegalovirus are kind of well known to have to cause harm in infants, but that risk can sort of vary in different ways, such as by trimester of infection. And so an early question really was whether SARS-CoV-2 infection in utero might kind of have similar effects or have any kind of level of risk. And obviously we've sort of seen the potential differences in expression of COVID and severity of illness. And so this has been sort of a lingering question, is whether infection during pregnancy has ongoing impacts in the infant's neurodevelopment. And so there has been some initial research on this and somewhat conflicting findings. So early studies showed possible higher risk of diagnosis of developmental disorders associated with intrauterine SARS-CoV-2 exposure. At that time, there was a particular complication distinguishing between intrauterine exposure and just the kind of the immediate effects of changes during the pandemic to the environment that children are growing up in. And more recently, there has been some more reassuring work that indicates that maybe there isn't a particularly substantial risk, but that those studies have sort of had limitations related to small sample size and other challenges. So we thought it was a unique opportunity with the Recover initiative to kind of explore this question. And in particular, the design of Recover is very well suited to look at this because as part of the Recover cohort, we particularly enrolled a large number of individuals who were pregnant during this period of time, January 2020 through December 2023. And not only among those people, both are those who had a SARS-CoV-2 infection during pregnancy and those who we have antibody testing to confirm that they did not have a history of SARS-CoV-2 infection during pregnancy. And so not only did we enroll these participants in the Recover adult study to look at the effects of SARS-CoV-2 infection during pregnancy on the adult, but we also enrolled their infants once they were born in a separate cohort of infants who had or did not have SARS-CoV-2 exposure in utero. So these participants are sort of doing double duty, both contributing on behalf of themselves and including their children. So it's a really remarkable effort by these thousands of participants that we have across dozens of sites. And as a result, we are able to look at these offspring. So this is the cohort that I will be kind of speaking on. And I'll kind of take note that this work goes up until 18 months of age, and we're continuing to follow these infants over the next several years, and we will hopefully continue to see their continued development over time. So our goal is to look as of the first 18 months of follow-up that we have on participants in this exposure cohort to see whether there is an association between intrauterine exposure to maternal SARS-CoV-2 infection and neurodevelopment over this period of time. We did that with two particular sets of assessments at 12 months and 18 months. So at 12 months, we had the ASQ developmental assessment that looks across 5 different domains that are sort of shown here. And then at 18 months, we used 2 other assessments, the ASQ-SE, which measures social-emotional development, and the MCHAT-R, which is an autism spectrum disorder screening tool. So we looked at the scores that come from these assessments as well as published thresholds that they provide that correspond with sort of whether or not a child should be referred to continued testing. So we had different ways of looking at the outcomes from these assessments. And what we did was we used regression modeling where we adjusted for a variety of potential factors that might be associated with infant neurodevelopment to assess differences between exposed and unexposed infants. So those are listed here. Among them are that we looked at the potential effects of timing of the intrauterine exposure, both to capture differences across Omicron versus pre-Omicron variants and to potentially try and control for differences based on kind of calendar time or pandemic effects. So our cohort that we had was about 1,200 total participants, children enrolled by 18 months of age. We have slightly different numbers because not everybody enrolled at 12 months of age. Some of them enrolled a little bit later. So we had, but still, nearly 1,000 children measured at 12 months and a little over that at 18 months. And in this cohort, broadly, the majority of the birthing parents were fully vaccinated before their first infection or the negative test that they enrolled with as an uninfected participant. And then the majority also, their infection, of the children who had intrauterine exposure, it was primarily exposure to the Omicron variant, and only about 20% of exposed infants were exposed in the first trimester as opposed to higher proportions in the second and third trimesters. The top line finding was that across all these different assessments, the ASQ scores and subscores at 12 months and the ASQ SE and MCHAT scores at 18 months, we did not see statistically significant differences between the exposed and unexposed children, even after adjusting for those array of covariates that I shared earlier. So here we have kind of the mean scores in each group, and then the adjusted differences. And in generally speaking, these differences are kind of clinically quite small relative to the level of uncertainty. So there's a little bit of variation in terms of directionality, but overall, modest differences between the two groups. And then when we looked at them again, thinking in terms of sort of this binary outcome for whether a child sort of exceeds some threshold that indicates potential delay or recommendation to refer to further testing, those proportions also did not show statistically significant differences between the two groups. So again, we see some variation, but in our analyses, nothing stood out as particularly of concern or strong evidence. So I won't kind of dwell on those. I'm happy to talk about them later. But generally speaking, what we found was that in this large national cohort, we did not see evidence of associations up through this 18-month age. So hopefully, we think this might kind of provide some additional evidence generally towards reassurance over this period of child development that we're not seeing major differences. And we looked at some additional analyses that tried to assess whether there was differences within groups by variant of infection, pre-Omicron versus Omicron, or whether there were differences by trimester of infection, sort of first trimester versus second or third. And even when we looked within these subgroups, we also did not see differences, and taking note of the fact that those are generally smaller subgroups within this. So we're continuing to follow these children and are looking forward to assessing them at further time points, 24 months, 36 months, and 48 months. That will be ongoing as we sort of allow these kids to continue to grow up. And again, I just wanted to acknowledge all of the participants and community representatives who have been involved in the research project, all of the PIs across many different sites, some of whom are here today, and thank you for your attention. So, thanks.